Virtual multidisciplinary team discussions for head and neck cancer patient management. Simple yet an elegant solution to a complex clinical problem. Head and neck cancer treatment is complex. Skills and experience of many different specialties are necessary for optimum cancer management. Surgeons, oncologists, radiologists, pathologists, and paramedics like speech therapists get involved in the treatment process. They need to work as a team to bring about best cancer care. MDTs are an integral part of contemporary cancer care all around the world. Working as a team leads to less clinical errors, better patient outcomes, sharing of management responsibilities, and non-fragmented clinical care. The sad fact is that MDTs are non-existent in most parts of Sri Lanka. What are the barriers to MDTs? Geographical distance between treatment centers is the major barrier. Heavy workload, opportunity cost, lack of interest are other common problems. These barriers lead to fragmentation of clinical care with suboptimal clinical outcome and poor patient satisfaction. ENT Department of Hambantota District General Hospital, in collaboration with Oncology Department of the Karapitiya Teaching Hospital, developed a simple but fully functional software solution using free and open source software. A web-based software was developed using Drupal, PHP-based content management system, and video conferencing was integrated to it using Google Hangouts and YouTube. Once a patient is diagnosed with head and neck cancer, the multidisciplinary team process gets triggered off. Data was maintained in both paper-based system and in an online server. Online server was accessible only to authenticated users with a password. Once logged in, an authenticated users can enter patient's data. First, MDT discussion date for that particular patient is entered, followed by clinical details. Pathology slides, ultrasound scan reports, CT scans, and clinical pictures can be uploaded to the system. Once the data is entered, an email is generated to the participants notifying about the data and also time of discussion. They can access the database and be prepared for the MDT, and on the decided date, the virtual MDT happens. MDT is carried out using Google Hangouts on Air. At the end of the discussion, YouTube video is generated and is stored in a private video gallery. At the same time, hard copies are maintained in the vault. Therefore, privacy and confidentiality is maintained. Online database server can be accessed by the MDT members at any point of care pathway. Once logged in, authenticated members can access the details in the web. The records are kept in tabulated format with all the clinical details which are easily accessible. To illustrate our point, let's look at an ultrasound scan of one of the patients. The data can be downloaded in various formats including Microsoft Excel and therefore can be used for further statistical analysis. World-class best possible cancer care to rural southern parts of Sri Lanka. Huge cost savings to the health system and to patients. Time savings to clinicians as well as cancer patients. Academic advantages like research and audit and continuous medical education. Above all, satisfaction for both patients and the treating clinicians. Using Drupal, Google Hangouts, and YouTube. Virtual MDT.